Dr. Daniel Hockenberry here with Ried Physical Therapy. So today we're going to be going through some more frequently asked questions. And today we're going to be talking about the knee. One of the biggest things that we actually can kind of see here with the knee I previously talked about was patellofemoral pain syndrome. I've also talked about arthritis in the knee and things like that. Now, one of the other areas that we actually tend to see here quite often is something that we call jumper's knee. So if you've never heard of that, sometimes they call it tendinitis of the patellar tendon. So that is the tendon that's below the front bone on the front of your knee. That big tendon that actually lies right below it. That's something that can get inflamed. Jumper's knee is called that because it's often usually due to a lot of jumping activities, a lot of heavy loading then down through the knee and the foot. The reason for this actually occurring is that the tendon there on the front, we have the patella, and then that lower tibial tuberosity that's actually down here below the patella tendon, and it actually gets a lot of repeated stress and actually a lot of stretch then through the tendon, inflaming it. So what tends to happen is that as that repeated stress occurs, it leads to some type of chronic inflammation that can start in there. If it's something that's not treated, it can actually last a lot longer and not go away completely on its own. So it's something that when you first start to realize that, it's either to dial back the activity you're doing or have someone actually start to take care of that in order to be able to get that kind of out of there. What we don't want is a chronic inflammation to start to build in there where the tendon's actually weaker. Then it is something that's a little bit more difficult to get to go away. But this is most common in younger athletes, but also can happen to anyone of any age group. Specifically basketball players tend to be ones that are very prominent in this. So that's just a little information on something that we tend to see there on the lower part of the knee.